Hello, this is Dr. Jazayeri. So today I wanted to talk to you about the importance of having your previous surgery information available. And the more information you have available, the better it would help your current doctor to formulate a plan and hopefully minimize disappointment in the future. So I have this very nice patient who agreed for me to share her photos with you online. She already had breast surgery before and she wasn't happy with the breasts. Her concern was they were heavy and they were kind of going to the side and just sagged, and she just wasn't that happy with them. So this is the photos that I have. This is when I saw her. So if you notice, obviously the breast is sagging, the nipples need to be lifted, there's a heaviness in the center. But also, I don't know if you can appreciate, this is the patient's right side. There is fullness up here compared to the left. And also, it's a little bit bigger on the bottom compared to the left side. But the top one is a little bit fuller, okay? So, fortunately, and so I said, well, I agree, they're kind of heavy, but the top, the right upper portion is a little bit fuller. I'm not sure why. I wish I had your implant information. And she said, well, I do have them. So great. So she had silicone 465 cc silicone implants on the right and 430 cc on the left. So I said to myself, well, I'm not sure why the doctor put a larger implant on the right side, because to me it looks fuller, and I'm not sure why, and I don't know why your breasts are going to the side. Did he make the pocket too wide, or I wish I had some more information like your pre-op photos. And she's like, well, I have that too. I'm like, well, great. So this is her pre-op photos. So if you look, so you can see she already had these her breast kind of went to the side. And look how, the top here is again fuller and it has a wider base on this side. So I'm not sure, again, why the original doctor went bigger on the right side. Sometimes, inexperienced doctors try to put bigger implants here. Well, not necessarily inexperienced, but, they look at the bottom, they try to fill this up with a bigger implant. But the key is to get the top even, because when a patient goes and wears a revealing dress, you're not supposed to show your nipples, right? That's indecent exposure. So we want to try to get the top even. And so if you look, she still has the same issues. The breast is a little bit bigger on the right side compared to the left side. Okay? And they're going to the side. So based on the information that I had, and she said she wanted to be about between 2 and 3 cup size smaller. So based on the information we had, really there was no guesswork needed. So we have a couple of studies that have shown that when a patient gets a breast lift, because we're tightening that skin envelope, right there, the breast can sit in a smaller cup. So even though we're not doing a breast reduction, we are tightening that skin. So there's about a cup size loss there. And there's a couple of studies that have shown that for every 4 to 5 ounce increase or decrease in an implant, the patient gains or loses a cup size. So we decided to go from 465 to 300 and then 325. So that's about a cup size. And I decided to use the larger implant on the left side. It's about an ounce difference. The smaller one on the right side to try to get the top more even. But I also, when I was trying to pinch her skin to do the lift, in the center there was some breast tissue there. And it was heavy and it was kind of in the way. So I decided to take a wedge excision. So if I show you again. So we decided to take a little bit of breast tissue right in the center. I took, I think, about a couple of ounces here with the skin. So then allow me to bring the skin together and also tighten that breast even more, bring it in so it's not going to the side like that. So I have a 2-week post-op. Now remember, she's only 2 weeks. There's still swelling. The skin is, a little bit yellow from just the healing process. The scars are fresh, but I hope you can tell the difference. You can see the top and then the bottom. I mean, it's much nicer shape, much more even. And if you look, the breasts actually look larger in a way, even though we use a smaller implant. Why? Because you're getting that nice, perky, projected look without being fake. And I have this discussion all the time, especially with some of the younger patients, because a lot of them just want to go big because their friend got so-and-so, so they want to compete. A smaller implant, the ratio of the width to the height is more like this. As the implant gets wider, the width gets wider than the projection. So it gets wider, but not as, you don't get this perkier look. So a lot of times it's better to use a smaller implant and do a lift rather than trying to fill a loose bag with a big implant. I mean, it's just not going to do what you want it, what you think it's going to do. So, you know, I always recommend with any surgery, with cell phone now, you have cloud backup so you can never lose your information. Just create an album. Let's say, you know, you're getting breast implant, call it my breast implant surgery, my breast surgery. So you put your pre-op photos there, you know, front and side, right? When they give you the implant card, make sure you take a photo of it right away and put it in the album. Now with saline implants, it's really important to know the fill volume of the implant. So for example, let's say you had, you know, a 300 cc saline implant. That's the minimum fill volume. Most doctors actually overfill the saline implants because from experience was found out the manufacturers were too conservative. And if you overfill them by about 5 to 10%, you get not only a better shape, but also less chance of deflation. So if you remember the 300, the implant could have been filled to 400 or even 420, you know, depending on some of these companies, you can go, you know, a lot more. So that's a cup size difference. And so if you do choose saline implants, make sure you ask or have your doctor write the final fill volume for each implant. And that card has your serial numbers, it's your warranty information. You know, there is warranties on these implants, so it's important to have those. But all of these information helps your doctor to create a plan that hopefully will minimize disappointment on your side. So I hope this information was useful. Please let me know what you think. If you have any comments, I appreciate anything that may be helpful to everyone. We also have a lot of information and before and after photos on our website, www.drjaz.com, drjaz.com. Thank you.